the fall, how it ends. It's the fall, how it ends. Or it's the fall, how we rise again. Ooh.
Good afternoon, all the PhysioTV viewers. Today we have a very special speaker with us who's an alumna of Sancheti Institute for Orthopaedics and Rehabilitation College of Physiotherapy, Dr. Eden Mehediabadi. She has done her research work on the theme of how to be fit during the post-menopause phase. And Dr. Eden is an assistant professor in community physiotherapy at St. Andrews College of Physiotherapy, Pune. We welcome you, Eden ma'am, and the talk for today is what does being fit post-menopause mean? So looking forward to real good insights on the same theme. Over to you.
Thank you. I think it's very humbling to have your own mentor, your own teacher introducing you. So I think I'd like to thank you for this platform to be sharing my ideas about what I have learned in the field. And so I'll go ahead and share a very basic presentation, but I'm hoping that this presentation will at least stimulate us to start thinking more about what we can do along these lines, a field that's very close to my heart. So I thought of starting off by mentioning why this topic specifically stayed with me throughout my master's and why I still hold it so close. At an age where I see my mother in the same phase of menopause and a lot of my friends' mothers as well, I realized that there is a lot to be done around this period of life, but at the same time, it is also very neglected. And so when I looked more into it, looked more into the cultural aspect, looked into what can be done ahead, it was very insightful. And so I'm very happy to be having this opportunity to share it with all of you. So what does being fit post-menopause mean? It has a lot of parts to it. First is understanding what menopause is, what the period post-menopause actually will entail. And then it's also this understanding of what we mean by fitness, which in today's world, we see a lot of distortion of the idea of fitness itself. So, unveiling menopause first, it is necessary to understand that this is a natural biological process which marks the end of a woman's reproductive span. So, it is not a disease. That's why it does not fall into the general array of what healthcare looks after. And I feel like that's why it's a lot of times left out. Now, the basic symptoms that we would commonly see, we must have definitely heard the women in our family experiencing is hot flashes, mood swings, disturbed sleeping patterns, a big shift in the body composition. They start suddenly putting on weight. There are changes in the bone density, very vague aches and pains. And it is necessary for us to look at it from an Indian perspective to know what we should expect exactly during menopause, looking at the cultural aspect of it. So in India, we have the Indian Menopause Society, and after a lot of research, they have given this average age of menopause in India, which is 47 to 52 years. And that is why when we know this phase, we start expecting what is to come around the age of 45, a little bit up and down 47. We start noticing the symptoms setting in. And we know that like menopause has phases. So you start first experiencing symptoms, you're in the premenopausal period, then the menopausal, and then the postmenopausal period. So now culturally, there are a lot of things. There is the genetics, the general lifestyle, your health throughout the reproductive years that will influence the onset and the later path of what is to occur after menopause. But the biggest problem that we are facing is the problem of trying to demystify certain myths that are surrounding menopause, especially because it is so commonly confused with old age. So, menopause does not equal old age, and this is something that we need to share with women who are going through this very natural biological process. That this is not the process of aging. It may have overlaps in some areas, but we cannot be looking at it as the same problem. And I think this understanding being more commonly shared in society and accepted will change the way in which we look at menopause and the way that menopausal women should be encouraged to be fit. So now, if we go on to look at the health challenges post-menopause, why is there this need to be fit? There are hormonal changes that are affecting the cardiovascular health of a woman post-menopause, primarily because the estrogen secretion, which is a very protective hormone in itself, is lost. So once this protective effect is lost, what estrogen is basically doing is that it is affecting the lipid profile of the body. So it generally attempts to decrease the low density lipoproteins and increase the high density lipoproteins. But in the absence of estrogen, we see the opposite happening. So the low density lipoproteins, which we generally call as bad cholesterol, are increasing, while the high density lipoproteins are decreasing. And this changes the way in which our whole cholesterol profile, when we start to take tests, the blood test, is visible. Now, another influence that it has is also an increase in the stiffness of arteries. So estrogen generally makes the walls of our blood vessels more flexible. But once this cardioprotective effect is lost, the arteries become more stiff, the walls of the arteries. And so there is a pressure that it exerts on the flow of the blood, and it demonstrates itself as an elevated blood pressure. Now, this in itself makes it very clear that if hormonally your cardiovascular health is being affected, you need to look at what you can substitute with to be a protective agent. So if you don't have a hormone now protecting your cardiovascular health, what other thing in its stead can you use? And the only clear answer that we have is exercise. The other thing is the bone density concerns, because there is a high risk of osteoporosis owing to 2 to 3% of bone loss per year, which is very, very steep in comparison to other periods of a woman's life. And so this bone density concern, we're looking at it in a very, very important light, because very soon this woman will start to also age. So at that point, 10 years down the lane, this is going to be aggravated even more. And we know the effects of having to be bedridden after fractures. After simple falls and it leading to a fracture, it can have very detrimental and long-term effects on health. So now when we look at bone density concerns again, there is a raised consciousness we can see in the Indian culture about the intake of calcium, the intake of vitamin D. Sitting out in the sunlight is something that has commonly been propagated in our culture. But along with that, the emphasis on the importance of weight-bearing exercises still has to gain a lot of influence in the minds of people. And so I think the physiotherapists here play a very big role, because if we stop looking at, we start actually looking at menopause as a period that we need to really contribute to, then we start more actively engaging ourselves in these conversations. So now if we look at the imperative of being fit, like why being fit matters, it is, very commonly we face this idea that, even if I don't exercise, life goes on. Like even if I do not focus on my fitness, life still continues. I mean, what stops? But then when we look at it as a need, we are looking at not just living, but we are looking at overall well-being. Like you can live, you can be alive, but how can you be alive to a greater extent? How can you boost your overall well-being? How can you improve your mental health? How can you mitigate the impact of these hormonal changes? Because eventually you are an individual living in a society, and your life, the way you are able to lead it, impacts everyone around you as much as it impacts you and your own mental well-being as well. And when we say fitness, we are being very clear here that it in no way implies conforming to current standards of an ideal body image set by society. So when a physiotherapist promotes fitness, we are not saying lose fat. We are not saying become thin. We are not saying you should look a particular way. We're talking about feeling healthy. We're talking about how you can continue to live a healthy lifestyle. And we're looking at how this is a way to prevent further problems that are arising from the general changes, the natural hormonal changes in your body. So I think this is something that needs to be emphasized, because a lot of people I have heard, they say that like we don't want to exercise because like we're not overweight, or I'm happy with the way my body looks. The way that your body looks is not what can be a motivating factor to exercise, not the only factor. And so we need to make sure that our patients, the community surrounding us, is not falling into this trap. So now, if we look specifically at tailoring exercises for menopausal women, there is a very specific approach that is well adopted by the community of physiotherapists after a lot of research over so many years. And the types of exercises recommended in general, if we look at them, there is strength training for bone health, there is cardiovascular exercises for the heart health, and flexibility and balance exercises for overall well-being. So this is put very simply. Like when we look at strength training, we're looking at a lot of exercises that would help build the strength of your muscles. And we're talking about strength not in terms of being able to lift weight, but also in terms of healthy, healthy continuation of everyday activities. So there are specific groups of muscles in women that are weaker owing to the gender and the roles that they have performed throughout life. And how can we now look at strengthening those major muscle groups of the body? Then when we look at cardiovascular exercises for heart health, these will involve more of the aerobic exercises. So we're talking about spot jogging, we're talking about a brisk walk, stair climbing, things that would basically elevate your heart rate. Then when we look at flexibility and balance exercises, it will work more with improving your posture from lengthening muscles that have shortened over time, owing to how you perform your daily activities, how you sit, what are the postures that you generally stay in throughout the day. So these type of exercises recommendations are now, when we put them together in a protocol, they have a very specific format in which they come together. And the format in which they come together will depend a lot on your patient's background. Like what are the time periods of the day that they have available? What is the equipment they have available around them? The space requirements for the particular exercises. You have to look at the background of whether the patient has had exposure to exercise before. Do they know what suits them? What is their response to exercise? Whether they are more comfortable indoors, what are their choices in terms of what do they enjoy doing? Because this is not a disease that we're trying to just put a band-aid on. We're looking at these exercises as something that have to be adopted as a lifestyle. So a lot of care has to be given to how we integrate this into their everyday life, to make it a habit, to make it something that then is not lost with time, but continues to stay. So this is not a protocol that can be prescribed for a week, for 6 weeks, for a month, I don't know, for half a year. It's something that we really want to make part of their lifestyle. So it has to really come together with their lifestyle. And ahead in the presentation, we'll look at ways in which, as physiotherapists, we can try to do that. Now, when we talk about a holistic approach, we need to also pay a lot of attention to breathing and relaxation and meditation. So, if we look at the recent rise in this understanding of the effects of meditation and the importance of mental health in overall well-being, we see that especially in the post-menopausal period, there is a very, very high prevalence rate that we see of depression. And unfortunately, in our communities, we are not still very positive towards depression and what it entails, towards even understanding what depression is. And this period in a woman's life, like it is the end of her reproductive span, is a very emotional time. It is a time during which a lot is changing in the body, hormonally, physically. So it requires a lot of understanding in terms of what the community can also do. But what the woman herself can do is also important, because then it puts her in charge. So here, meditation also plays a very important role, and specifically guided meditation. So when you are guided in what meditation exactly would mean, how it can be incorporated into your breathing exercises, how it can be incorporated into your overall span of the day, what times of the day would be suitable, how it can become a regular feature of every day. So that will become very helpful. Now, one thing I wanted to pull our attention to is that we need guidance from trusted organization on this fitness journey. And as physiotherapists, it is important for us to inform our patients of where these guidelines come from. So, because these guidelines become that helping hand during the fitness journey, and it once again restates the importance of why we are giving so much emphasis to exercises in the postmenopausal phase. So one thing is that we have the organization at the international level, which is the World Health Organization, that gives very specific guidelines of physical activity post-menopause. And if we look at their guidelines, they very beautifully take into consideration strength, like resistance training. They take into consideration flexibility, aerobic exercises, giving very clear dosages, and also helping us look at the contextual factors that would affect the way we formulate a protocol. And apart from that, we also have the National Menopause Society, which is an organization of India, the Indian Menopause Society, that time and again puts up researches that help to back the views of where this whole idea of exercise has come from and how it is still progressing, how we are still learning about the effects of exercise, how it can be incorporated better into the lifestyle of women. So these recommendations, it is helpful for patients to know where it's coming from. It's not an individual opinion. It is a body of knowledge that physiotherapists all over the world have slowly accumulated, have looked at through experience. So knowing that this is evidence-based, I think really helps the patient and also adhering to the program in a way. Now, another thing that is important is for to encourage patients to follow professional advice or the guidelines from authentic research and not trends that are generally visible on social media. Even though they may not be harmful, they may not be very effective. And that is our concern, that if we have this woman who is motivated to do something, to be fit, then why not give them the best guidance available? So I think we really have to step in there to identify women who need, like, who are motivated, and then reach out to them with what they can do. Because a lot of times when they have the desire but not the means, it gets very misdirected. And that is something we would not like for our patients to go through. Now, there are, of course, a lot of barriers to exercise, and this is one of the major concerns, that when we are looking at the need to be fit, we have to acknowledge that there are barriers, because till we do not identify and acknowledge them, it is difficult to devise ways in which we are able to overcome them. So the first being, I do not have enough energy, which is a very common thing, especially in the Indian context, because there are a lot of responsibilities still placed on the women of the household. And this phase also, one of the symptoms of the postmenopausal phase is fatigue. Now, it becomes very ironic to think that if I am tired, I should exercise to feel more energetic. So it is a general understanding that if I'm tired, I should be resting. So fatigue is looked at as the biggest barrier to exercise here. The others include I'm not motivated enough, it costs too much, especially if we end up making recommendations to join an exercise class or have a personal trainer come home, then it does not match with the patient's abilities, especially looking at the socioeconomic conditions. Then I am sick, there is nowhere to exercise, which is another common thing because as physiotherapists, we have the capacity through understanding the patient's contextual background to recognize spaces like a simple staircase for someone staying on the first floor becomes a way like an instrument for exercise. But the patient does not start off looking at it that way. So in a way, we play a big role there to now identify this space for exercise. I feel awkward when I exercise. This is something that, like if we look back at today, women who are postmenopausal, when we look back at their childhood and early adulthood, we will see that they have spent those years during a period when women being like girls being outside the house, playing sports, engaging in exercise was not encouraged in a way culturally. And which is why now also there is that awkwardness in exercising. And it is very ironic, but one of the challenges, like when I was doing my research on postmenopausal women and the exercise protocols, because I was doing a group of it online and they were at home, they felt so much more comfortable because they said, here, no one looks at us. Like, we can wear comfortable clothing. Now, if you ask me to do the same thing outside the house, I cannot wear track pants and be outside. And if I'm in other clothes that are generally more culturally accepted, it's not comfortable for me to exercise in those. So I realized what a big barrier it becomes when we very loosely prescribe exercises and say, oh, I want you to do this outdoors every day. And the patient will accept that protocol and go back home, but won't be able to put that into practice. The other barrier is I don't know how to exercise, which is a clear indication that guidance is required initially. And we need to be able to empower patients to confidently continue exercising. So just drawing out exercises sometimes or letting them know what is to be done may not instill that confidence. They may require hand holding initially till things become more automatic. I might get hurt, it's not safe. These are common myths that we still see around us, that, it is like a common thing that you might hear is that, if I walk too much, mera ghutna ghis jayega. So it's a very common thing that is also propagated sometimes within a certain generation. And this needs to be clarified through counseling. And the last one being there's no one to exercise with me, which is something so common throughout all age groups. I don't think I would also exercise without company, which is why we really need to start broadening our horizons and looking at how we're not looking at individual patients, we're looking at groups. Because if we want this to be something that is sustainable, we need to look at solving this barrier. Okay. So, like I was discussing while discussing the barriers, we need to look at counseling, motivation, examining priorities and goal setting with the patient. So, you are not giving them something that you think is fine. You are setting the goals with them so that they agree that this is what they also want to achieve. Discussing the protocol, discussing attitudes and what you expect as an outcome of this, because it is always rewarding to then think about what comes out of what I'm doing. Evaluating exercise opportunities in the environment. And here I feel home exercise protocols is something that we really need to pay more attention to. And in prescribing a home exercise protocol, we need to assist patients in looking at commonly available equipment at home as things that they can use for exercise. For example, if we want to do body weight training, so it is easy to prescribe exercises like wall push-ups rather than having the patient or the woman come for the first time to a clinic or an outdoor setting in which equipment is provided. I think that first instance where we provide equipment for them to exercise makes the exercise very dependent on the equipment. And then in a way, it paralyzes the whole process because then that starts looking like something that cannot be done at home. So a lot of times, the bars of the window grills become good bars to hold on to attach, I don't know, a dupatta to when you're doing flexibility exercises. So we really need to empower our women to become more innovative in thinking about how they can transfer this protocol to a home exercise protocol. And we, of course, are not looking at them doing this by themselves. So the therapist somewhere needs to be very deeply involved with the woman. Then we need to discuss adherence and reinforcements because it is a very common thing that you start off motivated, you're very pumped up, energetic, but how long? Are you going to be able to continue this for years altogether? And so we need to look at how you're going to adhere to this protocol, what would help, and how would you reinforce yourself? How will you examine self-efficacy, whether you're able to now be more confident, you've moved closer to your goals? How does the therapist help the woman develop social support structures by identifying the barriers? And the best would be, how can you assist women to find these exercise buddies? So we really have a base of patients now. We know other women who are suffering from similar complaints. So we have to really look at now how our network can assist our patients. How can we move away from looking at individual single patients to putting them together to assist each other on this journey? So, now this is specifically how therapists should be doing this, because I realize that throughout our education, during our bachelor's, our master's, we do develop a very a very specific understanding of the exercises that are to be given. So if today I have to jot down the exercises that I want a postmenopausal woman to do, I know exactly what it entails. I know these are the muscle groups. I'm looking at the major muscle groups. I'm looking at resistance exercise for them. I know that I'm looking at 20 minutes a minimum of aerobic exercise. Then I know that 3 days of the week I'm looking at flexibility training. I know which muscle groups I want to stretch out based on how the posture of the woman is. So I think we know the exercises, but we don't know what happens beyond just prescribing them. And that is the biggest problem we face when we try to look at results from having a woman in her postmenopausal period continuing these exercises for a long term, because eventually our exercises end in the short term itself. So counseling is one of the factors that plays a very, very big role, because it comes right at the start. And we need to first be able to assess the physical activity of our patient, their belief, their knowledge, their readiness, give them proper advice, let them know about the health risks, allow them the opportunity to collaboratively agree on the goals that are being set, assist them to identify and overcome barriers, and then most importantly, to arrange a specific plan. So when do you see them next? What kind of assessment do you do next? Can you teach them a specific test that they can do themselves, which when they perform better, they know that yes, this exercise is having an influence. And it can be the simplest of tests that you're teaching them to do for themselves. To enhance self-efficacy, you need to be seeing how the most, like they can really master certain experiences. They can observe others who are similar to them, who are having a positive influence from the exercise. It's always helpful to reach out to patients who have been adhering to their protocol and have them join in to share their experience with those who are starting this journey now. Then verbal persuasion, encouragement from others. Here it becomes difficult when we have not spoken to the family, when we are not encouraging the family to, go back and give these positive reinforcements. share that, like it makes them happy to see her exercise, or that, they feel like she's really, like, she's more radiant when she's exercising, she's more energetic throughout the day, and asking how they can also, join in, or how they can assist her in this journey. So we need to be looking at the feedback also in that sense, how the exercises can be a source of enjoyment and lead to a positive mood state. Now, the goals we are making need to specifically be very specific. They need to be measurable, they need to be action oriented, realistic, timely. This is the SMART goal. So we are looking at the same format that we would look at for any other patient. And it is important that we make clear at the start that we are looking at these goals as both short and long-term goals. We're looking at something that is moving along a continuum, but does not have a very specific end to it. Because we're looking at exercise then as a lifestyle. And reinforcements can be extrinsic, can be intrinsic. It can be very simple things. And like I've seen recently, like there was an experience during after I finished my research work with this group of 60 post-menopausal women. There was one woman who reached out to me later, because at the end we set a protocol that they were encouraged to continue. And she messaged me saying that recently her family, like, to encourage her to continue, they brought her a smartwatch, and they had set the pedometer at I don't remember what she mentioned. I think it was 7 or 10,000. And she said, those flowers that would pop up when I would complete my goal for the day was my reinforcement. And she said it was like, when she said that, when I think about it, it seems like such a meager thing. Like, how will those flowers popping up on my smartwatch screen really motivate me to now do this the next day also? But she said it is a motivation. I feel like I have accomplished something during the day. So I realized that, we sometimes place emphasis on a lot of bigger things, but very smaller feelings of accomplishment can really give our patients the confidence that they require. And this will come from a lot of social support. We need to really reassure women of their worth. We need to, a lot of times, there is this sense of giving up that, even if I exercise, kya ho jayega? Like, I'll live a few years more, or yeah, I'll be a little more energetic. So I think we really need to help our patients understand their worth. Like, we're not looking at them now as, just another part of society, but a very integral part of society. Yeah. Now here, looking at group exercise situations also is something very helpful. And if we look at the general body of postmenopausal women, there are so many commonalities, especially because they belong to a particular generation, that it is easy to socially integrate them and have this sense of belonging within a class. So we have to really now tap into this opportunity and see how we can really bring them together as a group, because especially this group nurtures each other. So as important as the therapist is, it also allows for this space to nurture each other as in a way, co-participants. Like I was talking about earlier also, this idea of self-monitoring. Very easy methods, wearable technology like smartwatches, visual documentation, tracking progress. Like now, I have women who have been asking whether, if I have seen any diaries, because now the new year starts, where you, like this, you have a habit tracker. You start putting in your progress towards a goal of, how much I have exercised today, how many steps I have climbed, or like, so they really want to now have this visual documentation to track their progress. And it's very motivating to see that women I worked with 2 years ago are still in touch and are trying to adhere and continue. So we now need to look at innovations in exercise. We need to look at how we can we can use public spaces also, because if we look at government initiatives, there is a lot that is being done to promote these open gymnasiums, where we can have groups coming in together. And yeah, like it promotes fitness in a way that I have been seeing women in groups coming together, trying to exercise together. There is this space to share your experiences. So another thing that can be done in this setting is also to read personal accounts from other women. And there are online, you will find these research articles that in a way cumulatively put together what women felt like, their comments. So these are basically like qualitative researches that look at the influence that exercise has had on the life of women, and they look at so many aspects of it. So it is very helpful for us to sometimes share this research with women who would be interested in reading. And because looking at the transformative outcome that it has brought about in women their age, women suffering from similar changes in their body, it really is a motivating factor that has a long-term effect. So yeah, with this, I think we can have any question and answers that, I mean, would help us delve deeper into it, or anything that, I may have missed, then it would be helpful to share. I would be very happy to.
So, although I think you have covered most of the vital points, or rather all of it, one of our viewers would like to know that how early should because here we are also coming up with concepts of prevention. So when exactly, because see, menopause is, again, we have a range of the age when it is going to hit the women. So how exactly the prevention should be planned?
So when we look at the post-menopausal period, more than prevention, because these are natural biological changes that are going to be occurring. So it is difficult to look at it from a preventive aspect, but it is very helpful to look at it from a continuation aspect. So like I was speaking about the phases of menopause, you have pre-menopause, menopause, and then post-menopause. And even though their symptoms are very similar, the phases are very distinct. And so, someone who starts exercising during the premenopausal period itself, when you first start feeling those hot flashes, or like when you know in the Indian context that around the age of 47, it's when it starts, at the age of 45 itself, why not enroll into a program? Because in the postmenopausal period, if I'm going to be prescribing an exercise protocol, it is so much more helpful to have a woman who already knows about exercise, who has felt that rejuvenating energy that you feel from consecutively being in exercise sessions with friends. So I feel like as a generality, it is helpful to have women start engaging in a, maybe start off more simple and then slowly start structuring the program at the age of 45 itself, if they already do not have it as part of their lifestyle.
Right. So, along with this, there is another question that, of course, we as physios are the exercise experts. But when it comes to rehabilitation, so even fitness and rehab in this age group and this gender, so who are the other important team members when we talk of both awareness as well as follow-up and follow-up care as well as fitness, everything? So who else should be consulted apart from the exercise experts?
I think this is a very important question because it is very, very rare that we will have women in this age group reaching out to a physiotherapist initially. So it really becomes important for us to then go out and collaborate with physicians, with gynecologists and obstetricians, and especially gynecologists, because at this age, they do face a lot of gynecological issues for which they will most probably go to a gynecologist. So I think having them as part of the team could be the first impulse that would help guide women towards physiotherapy. So, like I'm looking at gynecologists as one part of it, but I'm also looking at like those who are professional yoga trainers as a part of it, because especially if we are looking at physiotherapy, a lot of times we tend to become restricted, a few of us, in looking at diseases. So we may not be able to give that adequate time and energy to now have group sessions for women who we are not considering as diseased. So I think then it's very helpful to now incorporate others who are trained and professional to carry forward this journey with the women.
Okay, so with this, I think we have come to the end of the session, and heartfelt thanks to you from the entire PhysioTV team, from entire College of Physiotherapy. And I'm sure that with subsequent sessions, you'll keep enlightening our viewers with more such important themes on different domains of community physiotherapy. And we thank you once again for your time and your expertise shared with us. And we wish you good luck for all your coming endeavors.
Thank you. I think it's very humbling to have this opportunity with PhysioTV, and I think it's a very consistent effort that Sancheti College of Physiotherapy has been putting in. So I'm hopeful that this session was enlightening and it was helpful in a way. And of course, I'd love to know what other areas we could study more into, research more into, and share our insights about.
Definitely. Yeah. Thank you so much.